there's people bouncing between rooms or whatever. So. All right, so it's 10:55. We'll go ahead and get started. If people can wander in as we go, but welcome to our panel here. The floor is yours.
It's on now. Hi, everybody. We are from the Division of Behavioral Health under Department of Social Services, and today we're going to be talking about youth services in South Dakota. Before we jump on in with an overview of the division and then our panel, I want to introduce myself and have my co-presenter introduce herself as well. My name is Randy Peterson. I am the Substance Use Disorder Services Program Manager. It's quite a mouthful for the division. In a nutshell, what that means is I oversee SUD services across the state and just really provide that support and TA to those agencies that are providing direct care to individuals in need of substance use treatment.
And then my name is Shayna Smykel, and I am the Substance Use Prevention Program Manager, so that's also a mouthful. But essentially, I'm Randy's counterpart for the division, and I oversee prevention providers. So we funnel some funding through them, so we take that more administrative role to our providers across the state to provide the services in their communities. And then I also oversee our prevention efforts with the Avoid Opioid campaigns, so some naloxone distribution, lock boxes, Dispose RX, and all that fun stuff. So.
Thank you. All right, so just jumping into it, all we wanted to do was really show this slide and just talk about the Department of Social Services. So this is the state's largest agency with nearly 1,600 employees and 53 offices in communities across South Dakota. Really what we believe here is families have the right to be safe and secure. We want to provide opportunities and choices that support the needs of families through available and accessible services. We want to have collaborative communication, teamwork, partnerships, and trust for essential family services, and respecting individuals and cultural differences by treating people with dignity, fairness, and respect, focusing on meaningful outcomes, continuous quality improvement, and using technology to be efficient and effective. Professional and well-trained staff that is competent, accountable, empowered, and then providing quality, timely customer service through the no wrong door approach. Our vision and mission is up here on the screen. DSS is dedicated to strengthening and supporting individuals and families by promoting cost-effective and comprehensive services in connection with our partners that foster independent and healthy families. So really what we're here today as the Division of Behavioral Health is to talk about what we do and some of the youth services that are available. So we provide oversight of the publicly funded behavioral health system. Our funding includes mental health federal block grants, substance use and prevention federal block grants, other federal grant funds, such as the state opioid response grant that Shayna talked about, prevention grants, as well as Medicaid and general funds. What we mean by publicly funded is that an individual who may be 185% of the federal poverty level that's unable to pay for services out of pocket can access our funding. And that can be done at the provider level, just filling out forms, submitting that, and our providers work with those individuals in need of that funding, whether it's for low levels of care all the way up to our highest levels of care in South Dakota. The division also works with 11 community mental health centers, several substance use disorder treatment providers, and 22 prevention agencies. And we have a comprehensive array of services that we'll dive more into today, but they range from prevention, outpatient, all the way to residential or inpatient. We have detoxification services, as well as specialized services for individuals in need of those. So starting with our community mental health centers, like I said, we have 11 of them. They provide outpatient services to children, youth, adults, and elderly residents with acute mental health disorders or serious mental illnesses. To ensure mental health services are available to all South Dakota residents, we designate counties to each CMHC, which functions as their service area. It's also known as a catchment area. So that's what this map is really showing you here, is our different 11 CMHCs and the areas of the state that they cover. Rather than going into all of the services available that are listed on the screen, I just want to say that there's a wide array of wraparound services that can also be home and school-based as well as office-based. And our target population, or priority population, I should say, are adults with serious mental illness and youth with a serious emotional disturbance. So our substance use disorder treatment services, what this map shows is just that there's a variety of services across the state of South Dakota. We do have a key here highlighting the different levels of care that are available. And so outpatient treatment services, really that's going to include your early intervention, your assessment, individual, group, or family counseling, maybe some crisis intervention. And then we have our low intensity residential services, also known as 3.1, if you're familiar with that terminology. These are services in a residential setting that allow residents to really maintain employment and community supports while they're residing in a living environment or a sober living environment. So it allows that integration in the community while they're receiving treatment services. We have our inpatient services, which really provides a structured intensive treatment program for individuals with severe substance use disorder. We also have detoxification services for individuals who are acutely intoxicated or are experiencing withdrawal symptoms. Some of our specialized services that I just want to highlight briefly is intensive methamphetamine treatment services. This is really a long-term evidence-based program for individuals with a moderate to severe stimulant use disorder. And this programming really allows for the individual to cognitively recover and be able to retain and engage in treatment effectively, as well as case management. And then our pregnant women and women with dependent children programs, we have 2 across the state, one in Rapid City at Full Circle and one at VOA here in Sioux Falls at New Start. And really this is for women who are pregnant or women who have children ages 0 to 10 who are in need of treatment and would need to bring their children with them. However, just so you know, they're not required to have their children along. So as long as they're a parenting woman and they're in need of treatment services, maybe they're working towards reunification, they can still access this service. It is a low intensity residential service as well as an intensive inpatient service. And then lastly, we have 2 evidence-based programming for our targeted justice-involved adults. And then prevention services, which we're going to jump into more in depth. It'll turn on.
Okay, thank you. New to this whole microphone thing. So prevention services, we have in the Office of Prevention and Crisis Services, I'm gonna stand because I like to look at the screen, but we have substance use prevention, suicide prevention, as well as crisis services. So our substance use prevention, really, as I talked about before, we funnel funding through our division to our providers that provide the services in their community. Some of these services are community-based, which is essentially community-wide, where they can change policies, attitudes, beliefs in their community. Others are more school-based, where they go into the classrooms and they have a good relationship with the schools to provide the programming to our youth. And then there's also more individual-based for individuals that are marked a little bit more at higher risk for developing a substance use disorder. So there's some more individualized services that our providers do provide for them. We also have 3 prevention resource centers across the state that provide technical assistance as needed to anyone across the state and in their catchment area regarding prevention. And they also do provide some technical assistance to our coalitions. We do contract with 19 coalitions and then 3 prevention resource centers to provide these services. Suicide prevention, there is an executive work group that consists of different state agencies as well as community stakeholders that meet really regularly to discuss suicide prevention efforts in the state. And then there are also a plethora of sub-work groups that meet as well for some of our efforts. But just a couple of things we wanted to highlight are we offer free of charge trainings to different schools and communities as requested. And the website on the screen, the suicideprevention.org website, is where that you could go to request any presentation, gatekeeper training, anything that you would need, you can go to the website and request that. We also, along with our substance use prevention, our suicide prevention also has some awareness campaigns and promotional materials that are there for your use as much as ours to spread the word and spread awareness, and those can also be ordered free of charge from that suicide prevention website. The last part of the Office of Prevention and Crisis Services is obviously crisis services, and so they follow the 3 pillars of care, which is someone to talk to, someone to respond, and somewhere to go. So the someone to talk to is where we see 988. If you haven't heard of 988, it's that crisis hotline that launched last July 16th, 2022. And so that's that easy to remember number for anybody to call if they're in any crisis situation, whether that's suicidal ideations, substance use crisis, any sort of crisis. 988 is a number that you can call, and it's someone that can hopefully de-escalate the situation on the phone or get you in contact with the appropriate entity. The someone to respond is a mobile crisis response with a VEL e-care. So that's just someone to respond if there's a crisis and also bridge that gap into care as well. And then somewhere to go are the appropriate regional facilities that will provide that 24 hours a day care for anybody in a crisis situation. And so we're really vamping those up and are really excited about those efforts in our state. Thank you. This next slide just really talks about our prevention resource centers in a little bit more depth. They provide TA across the state, and they each have a library, which is in person where you can go check out materials, as well as we have many materials that are online now with the launch of the new Libby Library app to be able, so you don't always have to travel to your local resource center to get some of those resources. They also provide a lot of training around the state as well as some curriculums. I'm sure Stephanie will talk a little bit more about that as she works with our Northeastern Prevention Resource Center. This map on the screen shows the different catchment areas for them. And so we have a Western Prevention Resource Center located in Rapid City, a Northeastern in Watertown, and a Southeastern located here in Sioux Falls. And so with that, we are so excited to have a group of panelists with us and one attending virtually to really discuss these youth services in South Dakota and the services that they provide specifically. Just a little introduction, excuse me. We have Stephanie Kinander with the Northeastern Prevention Resource Center, which is located in Watertown. Next to her, we have Christy Vanderostein from Carroll Institute here in Sioux Falls. And then next we have Malia Holbeck from Avera Addictions Care Center here in Sioux Falls. And then presenting virtually, we have Michelle Brink-Glahusky with Lifeways in Rapid City. So with that, the first question for our panelists, and I think we'll just go down the row and then hit Michelle after Malia, is could you guys please offer us a brief overview of your program that you offer?
Hello, yes, my name is Stephanie. I'm, like she said, I'm from the Northeast Prevention Resource Center, and she did cover quite a bit of what the PRCs do. There's 3 of us across the state, again, in Watertown, Sioux Falls, and Rapid City. We do provide that training and technical assistance to not only the coalitions that work with the Division of Behavioral Health, but also any community that is interested in providing some prevention ed in their community. We also, like she said, maintain a resource library. We do have physical libraries in all 3 of our locations, but we also collaborated together to really bring some of that ebooks and audiobooks from the Libby app. So we all collaborate together on that with the division as well. We do provide evidence-based programmings to schools across our areas, as well as doing some diversion programming within our communities. At HSA in Watertown, we do provide programming for 17 and under, and then 18 to 20-year-olds.
Christy Vandy Rest. I'm from Carroll Institute. I'm the prevention program manager there. We have 5 counselors who go out into 8 different school districts. So we're currently serving Brandon Valley, Del Rapids, T area. I'll get them all. Let me think here. T area, West Central, Garrettson, Lenox, Sioux Falls Lutheran, and we're also going to JDC, the Juvenile Detention Center, as well. So that is what we spend our time doing, going into schools. And what we do is provide education and prevention curriculum, evidence-based prevention curriculums to K through 12th grade. So with those younger grades, it's more so talking about making good choices, identifying emotions, things like that. And then as they get older, talking about addiction and peer pressure, information on alcohol and other drugs. We also do substance use screenings and assessments for students who are struggling with substance use. And so it could be that they either get a violation at school, they might get something, some kind of legal charge, or they might just be struggling and seek us out at school. So we'll also meet individually and provide that service at school for students who are struggling. And then sometimes that might mean referring them on to another service or giving education one-on-one at school and doing some of those individual sessions. We advise or co-advise, depending on the school, SAD and TAT2 groups. So if you're not familiar with what those are, SAD is Students Against Destructive Decisions, and then TAT2 is Teens Against Tobacco Use. So those are student-led groups, and we just kind of are there to help guide them, mostly focused on either helping their peers to make good choices or teaching younger students lessons, encouraging them to make good choices. We also do a diversion program at Carroll Institute, so that is for ages 18 to 20. It's a little bit different than maybe the diversion you've heard from the courts. This is a different class and it is 12 hours. So I think that's most of what we do.
So Avera Adolescent Addiction Care Program is a 8-bed facility for ages 12 to 18. We do have a little flexibility to go a little bit higher for age groups with in that program as well. So we are able to accommodate both males and female adolescents. And we are in ASAM 3.7 level of care. So the adolescents are needing to meet that clinical criteria to be able to get admitted to our facility. Length of stay does vary a little bit, just kind of based on clinical justification for continued stay. However, I would say the length of stay is probably on average 28 to 45 days. Some days can, for some individuals can be a little bit longer as well. So for those kiddos that are participating in our program, their days are pretty busy. So they're participating in individual therapy, a lot of group therapy, family therapy. Since we're located in our behavioral health hospital too, we have access to some of the other specialties that we have within those programs as well. So we also integrate expressive therapy, rec therapy, and also have our psychiatrists and medical staff that also meet with our patients on a regular basis as well.
And then we'll tag in Michelle, who is virtual.
Hi, I'm Michelle Brinkle-Husky, and I'm the director of Lifeways in Rapid. And I won't repeat a lot of what Christy talked about from Carroll Institute, because a lot of what we do is very, very similar, except we're doing it in Rapid City and in the Custer community, which includes Hermosa. So we have 9 counselors, and they are school-based counselors. We contract or have contracted with the Rapid City area schools for 20 years now, and the Custer School District for about, it's been almost 9 to 10 years in the Custer School District. But our counselors are all credentialed by the South Dakota Board of Addiction and Prevention Professionals. And they're all either addiction counselor trainees with our clinical supervision that we provide, or certified addiction counselors or licensed addiction counselors. And primarily what we do is deliver universal, selective, and indicated prevention services in the Rapid City area schools and the Custer schools. And we use evidence-based curriculums that we deliver. And I should also mention, we've primarily been in the middle schools and high schools in Rapid City, which covers 3 high schools, one of those being one of the biggest high schools in the state, and then 5 middle schools. This year, we also were really excited to enter into the world of elementary schools, which we know we needed to do. We need to reach those early learners in prevention. So this year, we also started providing our evidence-based prevention curriculum in all the 4th and 5th grade classes in 3 elementaries. And next year, we'll be expanding that to 2 more elementary schools. Very similar to what Christy talked about, our counselors are in the schools. They're part of the school family. They generally have offices in the schools, and they are just building relationships. They're in the hallways, they're in the lunchrooms, they're in classrooms, they're delivering curriculum, they're meeting one-on-one with students. Our counselors, a big part of what they do is individual screenings, brief screenings with students to begin with, just to determine what the recommendations would be. And then we also can refer, and our agency can conduct full drug and alcohol assessments and can diagnose substance use disorders. Primarily, like I've said, we do prevention, but we also, in the last 5 years, have also introduced or have an outpatient treatment program as well. Our outpatient treatment program for adolescents is level 1 outpatient treatment. I know Randy talked earlier a little bit about levels, but level 1 is a low to moderate method of doing outpatient treatment. And it's kind of the first level. And that covers, it could be initial teens that have been diagnosed with a substance use disorder and meet that criteria for outpatient. It could also cover those teens that are coming back from a higher level of care, whether it's an intensive outpatient treatment or a residential treatment program. When they return to their home, we can provide that level 1 aftercare, basically. And I think that's mostly it. Otherwise, a lot of what we do is very similar to what Christy said at Carroll Institute.
All right, thank you, Michelle. On to our next question for the panel. How do youth access your services?
All right, so with the prevention resource centers, primarily we work with adults who work with youth, providing them the resources, training, curriculum that they might need to help implement this with the youth that they work with. In Watertown specifically, we do offer that diversion programming, like I said, for 17 and under, 18 to 20. We do get referrals for that through our teen court, through the Boys and Girls Club, the local school districts. Up in Watertown, we have Lake Erie Technical College, as well as the state's attorney in Cottington County. We also provide services to youth through our Natural Helpers program that we're just getting kind of moving forward. Also, we do, like I said, some classroom programming within the schools, and also SAD. We host a training every fall and then a conference every spring for SAD students.
At Carroll Institute, to access our in-school prevention services, there's really no criteria that they need to meet. Really, they can just hop into our offices when we're there. If they have a specific need as far as substance use or prevention, otherwise they can connect with their school counselors who will connect them to us. Usually it is the prevention counselor working with the school counselors and maybe the principals to kind of line up and figure out a plan for who's going to receive prevention services that year in the classroom. We kind of will plan that out based on maybe who's gotten them in the past, or they usually follow a curriculum And so they know what grades they want to target. So they just kind of work together year to year to figure that out. Some of our smaller schools will get prevention in every grade every year, but our larger schools a lot of times will focus in on some of those screenings and assessments. And so for those to be accessed, really they just need to hop into our offices on the day we're there, which is typically the same day every week, or talk to their school counselor who will connect them with us. As far as the diversion program, the students just have to have a screening or an assessment and be recommended to complete the educational course. Typically, someone who's completing diversion would not have a addiction diagnosis, and so they would just do that screening assessment and then be recommended to complete that course.
So there's a few different pathways to be able to get into our adolescent residential program. So I'd say the primary pathway of how our individuals are getting admitted to our program is they're just calling our facility. So we have an admissions line that anybody can call. For adolescents specifically, we want their guardian to be part of this process too, where we're clinically assessing them to determine if they are meeting that criteria for that level of care. If we are finding that they are meeting that criteria, they're appropriate for admission, we'll go ahead and get that admission date set up where we can get that coordinated for that adolescent. Another pathway is if an adolescent is working with a CD counselor already or goes to an agency to get an assessment completed, that counselor can provide that referral to our program as well. And then we can kind of pick up the ball from there and be able to continue to help that individual get admitted into our program. Also, I would say the last pathway that we also see individuals getting into our program too is if we have adolescents that are admitted to our behavioral health hospital or to our main campus hospital, we deploy our chemical dependency counselors to meet with patients in our hospital systems as well. So that's kind of determined by the physician if they want our counselors to come meet with the individual. But if we are meeting with that patient bedside, they are appropriate for an inpatient level of care and are wanting to get into one of our programs, we can get that admission process started for that individual at that point as well.
And Michelle.
So again, sort of ditto a lot of what Christy said, except for in the Rapid City and Custer area. But youth can be referred to us, and they are referred to us from all different resources. We have a very active and really well managed diversion program in the Pennington County State's Attorney's Office. And so we have students that are referred to us through their program, through diversion, through school administration, teachers. Students are referred by, mental health counselors, parents, and we have self-referrals. So again, we have our counselors that are based in the school. And so students can find that counselor usually in the counseling office or somewhere else in the building. They can check with the front desks or whatever, but most of our students know exactly where the Lifeways counselor is located to reach out to them. Also, I would say too that although our counselors are based in the schools in Rapid City, in the Rapid City Area School District and the Custer School District, we service students from all over the area. Pennington County is fairly large. It includes Hill City, Wall, New Underwood. So, and in addition to the community of Box Elder, which is an entire different school district, the Douglas School District. And so the students don't have to be in the Rapid City School District or the Custer School District for us to service. It's just that we wouldn't service them obviously in their school. So we do get students from other areas, and we just meet with them at our main office. We have a main office in Rapid City and downtown. That's kind of our home base. That's where our outpatient treatment program is, and that's where our counselors can meet with those students that aren't in those districts. But we do have a website, and if anybody wants services, if parents or other resources are looking for services, it's just a matter of calling our main office. Even if they're not sure how to get a hold of the counselor in the school, call our main office and we'll connect them with that school-based counselor as well.
Thank you. It's always great to hear how to get connected with the resources and all the different collaborations you guys have with other agencies. Looking at the time, we want to kind of move forward with the time. So we're going to move on to the question, what challenges do you see youth are experiencing, and what is your agency doing to address those challenges?
So one challenge that we see is just a lot of misheard information or misinformation that we do see around vaping, marijuana, alcohol, different tobacco products. So we do hear a lot of that misinformation regarding drugs, and youth specifically are being told some of those things. So we do continue to provide that classroom education, utilizing programs like Life Skills or Too Good for Drugs, so that we can hopefully provide the accurate information that our young people need to make educational decisions around substance use.
One of the bigger challenges that we've been seeing this year, and one thing I neglected to mention too, is that we also do threat assessments for students who make a threat of violence at school. So that's been something that has been challenging for us this year. We've had a lot of those coming in, not just from the districts we serve, but from other districts as well. So, and they are time sensitive, of course, trying to get them completed so the student can get back to school if that is appropriate. So trying to get our counselors able to do those when they're also in the schools has been a lot, as well as our vaping referrals. We do get vaping referrals from school. Frequently is typically where they come from. So trying to keep up with those vaping referrals and the threat assessments this year has been a challenge for us, I would say, because there is only one of us in each district. So just trying to provide what is needed and not let the other things kind of drop as we're doing so.
I would say a couple challenges that we have is one, being able to find access to some of those lower levels of care, especially in some of our rural communities. So we're seeing adolescents from across the state too. So I think that's kind of one challenge that we do or have is with kind of that aftercare planning for those individuals. Another challenge that we see too is so the kids have family members that also might be struggling with mental health and addiction themselves. So they're kind of going back into an environment that provides some vulnerability for their own recovery process as well. So a couple things that we're trying to do to kind of overcome some of those challenges is one, to get an aftercare group started in Sioux Falls for adolescents to be able to participate in. And then also, we've also been trying to get more information into family members by offering a complimentary family program to all family members and support people in their lives too. So we've been able to do that by a benefactor that's been able to donate money to our family program. So we do a 2-day program for any of those family or support systems that do want to participate, so we can kind of get the information in front of them about, one, how to best support their family member that's struggling with addictions, but two, also to kind of give them the help and support that they might need should they be struggling with addictions and mental health themselves.
And Michelle?
I would reiterate what everybody else has said are similar challenges that we see as well. I would add to that, one being the evolution of cannabis use. You know, we started with Lifeways seeing the problem with, I guess, societal permissiveness with regards to cannabis. You know, it's been ongoing, but really when it began, especially in Colorado, because it's our neighboring state, when they legalized cannabis, is when we really started seeing more of our students and our families be a little bit more permissive with misinformation, things like that. And of course, it's just evolving And so that's a concern. And with that, I would say the increase of THC content is very scary. And it is a challenge as well. Previous folks on the panel talked about vaping. That's a concern with absolutely nicotine. But vaping, cannabis, THC is also a concern. I would also say with that, when I talk about permissive use, another challenge of ours, and it's an ongoing challenge, is permissive societal use of alcohol and tobacco. And now, of course, with marijuana, and it just, it's a challenge because we are constantly having to try to educate and inform people and make folks aware that regardless of adult use, it's not okay for adolescent use, and educating people about why it's not okay. And sometimes we hear of stories, whether it's methamphetamine, fentanyl, which are hugely, I mean, they're crisis and it's very scary, but we tend to forget about alcohol, marijuana, and tobacco. And so I think those are ongoing challenges that we see.
Thank you. Just to wrap up, I know we're at time. I wanted to show you just a couple slides. This is our interactive map. You can also scan the QR code. That's going to show you what providers are available in your area. You can click on each county, and it'll be the publicly funded and what they serve. And then lastly, this QR code is going to take you to that same spot, but there is a link for agencies who do walk-in assessments and agencies who provide telehealth services across the state of South Dakota. If you have any questions, you can catch any of us quickly. Otherwise, thank you so much for sitting in today, and I hope you learned something.